Just over 9,000 positive cases of the coronavirus have been confirmed in Africa. Around 400 deaths have been confirmed so far. While this is just a fraction compared to the global figures, health systems on the continent are greatly threatened. The World Health Organization has been working closely with the African governments to plan for the needs of communities. To tell us more about where things stand is the World Health Organization's technical officer, Dr. Mary Stephen in Africa. Dr. Stephen, a very good evening to you. Thank you for being on ENCA. So, the latest numbers then in South Africa, we've confirmed 13 people who've died from COVID-19, infections at 1,749. How are you reading or interpreting this data?
Okay, so the outbreak is currently evolving across the continent in Africa. So under WHO Regional Office for Africa, 45 of the 47 countries are currently reporting cases. So yes, South Africa is reporting the highest number of cases, but we are also seeing response by the government to curb further spread of the outbreak in terms of dictation of the cases, the aggressive testing, isolation, treatment of the cases, and also contact tracing, in addition to the social distancing, hand washing, cough etiquette, and the lockdown that is currently happening. So we know that these measures, if implemented aggressively, can curb further spread of the outbreak. So yes, we have quite a number of cases, but it is possible to break the chain of transmission if we implement these measures aggressively. So in the coming weeks, I believe South Africa will start seeing decline in the number of cases, and we call on also the general public to adhere to the measures that government is putting in place so that we can win this war together.
And Dr. Stephen, one thing that's been said, as you say, that you're expecting, for South Africa at least, the picture to improve over the coming weeks. One of the things that we're seeing in China, for example, where Wuhan is about to lift the lockdown, is the worry about a possible resurgence, a second wave of infections. And that speaks to how life will likely have to change for many parts of the world, especially with the absence of a vaccine for this coronavirus.
Yes, so what government can do is to plan ahead. When we get to that point where these measures will be removed, we need to enhance the capacity for early dictation, meaning that a very good surveillance system has to be in place to detect all the cases early enough, and we have to continue the testing. In addition to that, we also need to enhance interventions at the points of entry and monitoring of all travelers arriving. So once we have lifted these measures, we have to make sure that we strengthen all interventions at the points of entry, taking the information from travelers, following them up for 14 days to see if, in case if they develop symptoms, so that they can be isolated early and treated. And of course, their contacts followed up for 14 days. So if we need to start thinking about this already before these lockdown measures are actually removed or relieved.
The issue around the personal protective equipment for healthcare workers is sparking somewhat of a global race to acquire these essentials, including masks and surgical gloves. When you look at the way the more developed, wealthier countries are going about it, do you get the sense that Africa may be disadvantaged in that race, if we can call it that?
So for the personal protective equipment, yes, we know that we are running down on the global stock for the personal protective equipment. That is why we are advising that we need to use the personal protective equipment rationally, so that our health workers will have this personal protective equipment to protect themselves in the hospital when they care for the patients. So, but right now, what we have, the PPEs in the continent, and we also know that there has been additional supplies of the personal protective equipment by the Jack Ma Foundation and the Alibaba Group, and we understand that they are also going to restock these supplies in Africa again. So, but in addition to that, we can continue to explore additional options in terms of how we how we will restock this personal protective equipment and continue to source for more as the cases are ongoing. But once we are able to break this chain of transmission, then the requirement for the PPE is going to reduce, and of course the pressure on the African continent will also be reduced. So as we continue to source and look at other options to get additional PPEs, we need to continue to implement these aggressive measures for containment of the outbreak. So we need to protect our health workers, yes. So the general population, we also need to collaborate to make sure that our health workers have this personal protective equipment to treat the patients in the hospital and also protect themselves from getting infected and protecting their families as well.
One thing that's also been making headlines since the weekend is the racist-laden suggestion that was made on France television that was at the end of last week that Africa should essentially be where the vaccines, when the time comes, are tested. A lot of people saying that Africa is not a testing lab for the rest of the world. It's not a dumping ground for these vaccines and the like. The head of the WHO, Dr. Tedros, joining the voices of condemnation in the briefing in Geneva on Monday. But how do you, as the WHO and the rest of the world, make sure that individual countries don't open themselves up to those trials just out of sheer desperation for wanting to find a cure for their people?
Yes, so the ongoing research is good in terms of trying to find solution for the outbreak. Of course, the therapeutics and the issue of the vaccine, but we need to follow the protocols. The protocols have to be followed. So there is a protocol for everything, for the therapeutics and including the vaccine. And this is what the DG is calling on all countries to make sure that when we get to that stage, we do not engage in unethical procedures, but making sure that we follow the protocols, and this will be implemented globally across all the countries of the world, not just limited to Africa, but making sure that there is an ethical approval for these processes and the protocols are properly followed and monitored.
Right, Dr. Mary Stevens from the World Health Organization in Africa, thank you so much for being on ENC.